Hello everyone. In this video, we are going to see about emerging challenges in pediatric healthcare. I am Dr. Celeste Mary, Vice Principal in Administration at Triplum College of Nursing. Objectives. By the end of the session, learners will be able to define the term emerging challenges, enlist the objectives of child healthcare, and explain the child health services, and able to discuss about the philosophy of pediatric nursing care, and describe the emerging issues in children, and enumerate the great challenges in pediatric care, and able to discuss the framework for improving the quality of pediatric care, and explain the safeguarding the future of pediatric care. Introduction about the topic. Ensuring their healthy growth and development is to be a prime concern of all societies. Newborns are particularly vulnerable and children are more prone to malnutrition and infectious disease, many of which can be effectively prevented or treated. Taking care of children and their families has been challenging and that is becoming more complex. Child health care has changed dramatically in recent years due to advances in medical knowledge and understanding emotional response of children. Advancement in medical technology have enabled many children and adolescents with serious disease to survive conditions that were once considered fatal. At present, in child health care, more emphasis is given on preventive approach rather than curative care only. The challenge of this time is to study the child health in relation to community, social values and social policies. Moving on to the definition of the term emerging challenges is used to describe the process of identifying and studying issues that have not been influential or important in the past but that might be influential in the future. Moving on to objectives of child health care. First objective is decreasing childhood morbidity and mortality rate. It means early access to high quality care, monitoring whenever appropriate and treating pre-existing chronic conditions is very important. Considerable amount of progress has been made in reducing childhood mortality since 1990. The under 5 deaths has declined from 12.6 million in 1990 to 5 million in 2020. Second objective is promote and protect health of child. Child's well-being is a key part of ensuring them safe, helping them to develop positive outcome and to function appropriately for their age and sex level. And next is about nutritious diet to children. Healthy eating habits in childhood and adolescence is important for proper growth and development and help to prevent many chronic diseases. Next objective is monitoring child growth and development. Here, it's very important to determine whether the child's development is on track and to rule out the normal milestones of behavior in children. And foresee the complications and prevent them. It means proactive rather than reactive. By preventing the problems, the amount of resources, time and cost spent on solving these problems can be reduced significantly. And last objective is to detect high-risk cases and give them special attention. It means you have to give special attention to those in greatest need and at risk and able to do the early identification and appropriate management. Next, we can move on to child health services. It provides medical treatment, the maintenance or improvement of health through preventive measures, early diagnosis and treatment. It includes newborn care and breastfeeding, immunization, it means protects the child from diseases, monitoring the growth and development, personal hygiene to be maintained, early identification of health problems and treatment, prevent the infections and high quality of care and support and treatment. Next we can see about philosophy of pediatric nursing care. Children need accessible, continuous, comprehensive, coordinated, family-centered and compassionate care that focus on their changing physical and emotional needs. Pediatric nurses provide this care by focusing on the family, providing atraumatic therapeutic care and using evidence-based practice. First, about the family-centered care. Family is the child's primary source of support and strength. Collaboratively involvement of families and caregivers leads to better outcome and satisfaction. The positive outcome observed in children include decreased anxiety, better pain management and short recovery times. A traumatic and therapeutic care that minimizes or eliminates the psychological and physical distress experienced by the children and their families in the healthcare system. Next about it, promote a sense of control, prevent or minimize bodily injury and pain. Care given to all children, including young adolescents in health facilities, is evidence-based, safe, effective, timely, efficient, inequitable, and appropriate care for their age and stage of development. Next, we can move on to emerging issues in children. These issues have become more common and they are almost perceived as unsolvable problems. But we now know the community consider them to be a biggest health problems for children and teenagers today. And also the parents are concerned that these issues can impact their children. Examples are bullying, cyberbullying, that is 34%. The harassment takes place in person or online. The actions can have deep effects on child's mental and physical health. So families need to watch for warning signs and they have to watch the child's activities. Next about the internet safety. Nowadays it is a major issue. Children can put themselves at risk by talking to strangers via social media, chat rooms or message boards, etc. That's why it's important to regularly monitor the children's internet use, stress and the values of securities, etc. Next, stress 28%. Children also can stress themselves, but the stressor need not to be a life threatening. Parents need to find out what is causing the child stress and try to find out their concerns in perspectives. And the key method is the conversation between them, and school or professional counselor can offer guidance if needed. And next is about the motor vehicle accidents. Here, the children are more prone to get the type of trauma experienced by the children. Social violence is prevalent in all countries and include physical, psychological and sexual violence and bullying. The root cause include the gender and social norms, etc. So next about the depression. Increased stress levels can lead to depression, and but signs of mental health conditions may not be verbally. Instead, an unaffected child could become withdrawn and show little interest in friendship or hobbies and decline in academics. Unhealthy eatings. Children can be picky eaters or prefer the junk foods. Parents need to be strong in determining what type of food they buy and also in setting an example for children by making healthy choices. And next about the issues is not enough exercise can lead to increased risk of obesity and diabetes, and drug abuse is a substance abuse refers to use of certain chemicals for the purpose of creating pleasurable effects. And next about the sexting is a common issues. Sexting is the sending or receiving or forwarding some sexually texted messages or photographs or videos between mobile phones or oneself to others. It can also include the use of computer or any digital devices. These are some of the issues of children. Next, we can see about great challenges in pediatrics. First one is genetic disorders. Is caused by abnormalities in one or more genes or chromosomes. It leads to chromosomal abnormalities that include certain types of birth defects, chronic diseases, developmental problems, and sensory defects. There are over 6,000 known genetic disorders. More than 600 genetic disorders are treatable. Around 1 in 50 people are affected by known single gene disorders. And in many cases, there is no treatment or cure for chromosomal abnormalities. However, the genetic counseling, occupational therapy, physical therapy, and medicines can be recommended. Second challenges is prenatal diagnosis. Here, prenatal testing can be performed by invasive or non-invasive methods. It is prenatal testing in recent years have been moving towards the non-invasive methods, and the rapid advancement of modern high performance of molecular technologies along with discovery of cell-free fetal DNA and in maternal plasma leads to new methods of determination of fetal chromosomal abnormalities. Next, third one is this digital eye strain. Nowadays, computers have become a part of education, business, socializing, chatting, and recreation. More and more people today are spending major time in front of the computers, and many researchers and ophthalmologists are concerned that added blue light exposure from computers and other digital devices may increase the risk of age-related eye diseases like macular degeneration and future life. Digital eye strain is a collection of visual discomfort like redness, dryness, fatigue, irritations, headache, neck or shoulder pain. Next challenge is limited resources. Difficulties still exist in providing medical treatment to geographical areas which have difficult access and limited resources. Socioeconomics and structural barriers for care within health services still remain obstacles to provide optimum treatment for certain conditions. Next is moving to trauma. The recent studies have shown unexpected evidence of occurring permanent disabilities resulting from traumatic brain injuries among children is the primarily accounted mild injuries rather than severe injuries. Next is introducing new devices and new drugs. The is also a challenging problem in children, and its characteristics of physiology, pathophysiology, practical and ethical difficulties in designing preclinical and clinical trials is challenging to identify appropriate experimental models, and solutions for these issues require collaboration between industries and government as well as creativity in designing pediatric studies. Next, moving to education and training for caregivers. Um, Here, it is important for training non-technical skills is becoming the prominent in field of enhancing safety of patients. Influence of patients' lifestyle, obesity and associated related complications like diabetes, hypertension, cardiovascular and respiratory disease are the highest risk factor for mortality and morbidity in children. Those parent perceived stress is correlated with the child's fast food consumption and important behavioral indicator of obesity risk. Finally, the ethical and legal issues in pediatrics is the challenges with regard to informed consent, assent and vulnerability and potential conflicts of interest. Pediatric health researchers should advocate for certain research participation by children. It is the researcher's responsibility to safeguard and maintain the privacy, dignity, respect, privacy and protection of the research participants. Next, we can move on to framework for improving the quality of pediatric care. There are 8 domains which reflects the priorities for assessing, improving and monitoring the quality of care in healthcare system. The 8 domains are organized into 3 main categories, that are quality of care and desired health outcomes and provision of care. The domains of the framework are evidence-based practice for routine care of children and management of illness, actionable for information system, and third one is functioning referral systems. Fourth one is effective communication and meaningful participation. Fifth one, respect, protection and fulfillment of child's rights. Sixth one is the emotional and psychological support. Seventh domain is competent, motivated and empathetic human resources. Final domains is essential child and adolescent friendly physical resources. This framework provides a strategic approach to improving the quality of care at all levels of healthcare system in order to foster continuing culture of quality and to ensure safe, effective child, adolescence and family-centered care. Next, about safeguarding the future of pediatric care. All children should be able to access safe, high quality services in an appropriate location within an appropriate framework irrespective of their geographical location or social background. Nurses required to be up to date in their field of specialized care and cooperate with their co-worker team members, especially the medical counterpart in intensive care, neonatology and any special care system, and it includes existing infrastructure for healthcare needs to be strengthened. Health should be perceived as an investment and receive greater budget allocation. Education, safe water, sanitation near priority, vaccination coverage to be improved, better implementation of national health programs. By these measures, we can safeguard the future pediatrics. Moving on to the conclusion of the topic, health of children is a product of complex, dynamic process produced by the interaction of external influence. A pediatric nurse has to face various challenges on the following aspects such as need-based, problem-oriented, risk approach, and practice for better child health.
Thank you.